Another area of reform that does appear to be working, opioid restrictions. As states have taken action and there's been policy crafted to rein in abuse of opioids, we do see some progress. And here to talk about that progress, John Edmonson, Director of Wellness at Healing Springs Ranch. And John, thank you for checking in, taking the time with us. Let's take a look a little bit at some of the policies, some of the changes throughout the course of this year in particular that you think is proving to be effective as we're combating the opioid epidemic.
Well, sure, Brian. Again, thanks for having me on your show. So as everyone knows, the opioid epidemic has been a challenge for a while now, and it took some time for state and local governments to really become aware of what needed to be changed. And part of that change is they're now trying to really restrict the use of opiates and really make sure that doctors are being much more intelligent and smarter about prescriptions and about follow-ups as well. So we are seeing some shifts, yet there is still a long way to go as far as what we need to do to really make an impact in that epidemic.
All right, so I want to give you an example, and you tell me if it's fair or not, and to kind of illustrate a change in the way doctors might go about their business that can make a difference. Let's say, for example, you go in and you're ill right now. It might be a cold, it might be the flu, it might be something, undetermined. Often you'll walk out with a Z-Pack. That seems to be the go-to for whatever ails you, in that kind of genre. It seems like for many years, if you've had pain, an opioid has been the go-to. And is that more or less what you've seen in medicine?
So what we see is a lot of times doctors with really good intentions are trying to make their patients feel good and feel better. And they're also, sometimes they receive pressure from the hospitals as well because, patient satisfaction is very important to a hospital, and that can relate back to what they perceive as the level of care they're receiving from that physician. So as a good intention, many times doctors are prescribing painkillers because the patient is saying, I'm in pain, I don't feel good, please fix me. Based on what they know, based on what they understood, although it's now changing, they were prescribing these pills to make them feel better. But just like you said, a Z-Pack can be fabulous, but maybe there's other things going on that need to be evaluated, like someone has allergies, and that's part of the reason they're not feeling well, so that needs to be assessed. Same things with physical pain. A more integrated approach is the best way to look. What is the pain actually about? Sometimes they do need the medication. Sometimes they need physical therapy. Sometimes, and many times the patients don't realize it themselves, their own anxiety, their stress is creating tension in their body, which is resulting in pain. So anxiety and stress, if you already have back problems, can literally increase your back problems. They go to the doctor, they say they need pain for their back, they take the medication, they feel better, and they don't realize they're becoming addicted to that drug, not just for the physical release, but also the emotional as well.
So, John, along the lines of what you're talking about there, I think you hit on something that is really important in this conversation. The expectation that we have going into any type of medical establishment. We're an instant gratification society. Something's bugging us, we want to fix. And so there's this expectation by us that might not be fair, that we're going to walk in here, you're going to figure out something that's wrong with me, and I'm going to walk out of here with something that's going to fix it. How much of that is the problem, and how much of wanting a happy patient is the problem that's led to maybe a lot of this abuse?
Sure, Brian. I think you're spot on. It's a great point to bring up that we're also responsible. We need to be good patients in the sense of being very active on what we're looking for, having good expectations, and really looking into ourselves to see what we can do to make that shift. Many times we are in that society of, I want to feel better within 15, 20, 30 minutes. But the reality is, for back pain or physical pain, it may take months, weeks, or longer to get that achieved. Same thing for emotional stress. Many times we're not taught resiliency in the schools or in other places, how to manage our stress, how to manage our anxiety, or how to actually lead ourselves to a process of change. So with that high level of expectation of fix me now, or I'm going to complain, or I'm going to say you're a bad doctor, does put the doctors under a little bit of pressure. And at the same time, the doctors need to be aware that they're wonderfully trained medically. They're wonderfully trained to assess the body, to look at the medications needed. more training needs to be there for doctors and anyone in the medical field of adverse childhood experiences, how past trauma, how stress and anxiety is affecting their patient. Because if they see that, many times they may be able to catch that this patient is coming in with stress and anxiety or other things going on that may mean they need some education around the medication they're taking so that they don't get caught in that feedback loop or they don't have unrealistic expectations.
John, do you think we're turning the corner, or are we still fighting the uphill battle?
I think we're right on that point. There's so much more awareness than there used to be, Brian. Before, people didn't even know what was going on, and they thought if you got addicted, you're an addict. Now we're starting to understand that there's so many more factors going into it, and there are doctors out there that are starting to listen and really make that change.
Appreciate it. Thank you very much for the information and the time.
All right. Thanks, Brian.
John Edmonson, Director of Wellness at Healing Springs Ranch.